and historic community, Black community, Detroit. I'm hyper aware of how we are portrayed, our Black communities are portrayed in America when it comes to whatever issue that people are fighting. What's this narrative and how do we get painted? So when the pandemic occurred, I saw a lot of alarming newspaper articles, stories that did not tell the whole truth or tell the whole story of how everybody's being impacted or the reasons why we're being impacted the ways that we are. That inspired me to try to seek answers. And so I started asking people, would they want to come together to ask people who are in the front lines, elected officials, ask, community leaders, what's going on? How are we being impacted? What can we learn from our past so that in the future, we have a stronger chance to curb the impacts of all these different phenomena that are happening? I have not asked for any corporate sponsorships. I have done this completely on my own. There is a Facebook donations page. If you want to donate, that will help us move to another platform. If I could just share really quickly with you all, the purpose of our event is to educate. That's one thing we're already doing today, having great people come out to talk to us, to inform us about different issues that impact the cornerstones of our Black communities across the US. To unite, we're uniting with everybody. This is not just the Black communities. This event is for and intentionally created to talk about and address issues that impact the Black communities around America, but it's not solely for Black Americans. We want a coalition with everybody who's willing to help us, to strategize. We're bringing together some incredible people who have been thinking about the issues for a long time, who have been fighting against it, and who are just really motivated. But we also want you to be involved throughout the next 3 weeks as we continue to have our summit, where you're engaging us and you're talking to us about how do you feel? If you think that the things that we're talking about is relevant or not, or will be useful. And then last, to inspire. I'm just an event planner. I am not here to have all the answers, but I know that I can use my skills to bring people together and to create a place, a safe space for us to unite and to educate each other and to strategize so that when we leave here, we're inspired to hold strong and to help each other. I want to, one more time, ask that you donate if you can, because again, we want to change our platform to Hopin, which will allow us to have breakout sessions where we can actually go from having the conversation with our panelists to having us talk about it and then going back into the conversation, or talking to elected officials, then posing a question within our community, coming back so then we can have an answer as we continue the conversation. So I want this to be very interactive. Any donations that proceeds past the platform fees, we will donate to different organizations or groups that either the groups have suggested or that the panelists represent. We will not be donating to any campaigns. We're open to having elected officials come on so that they can talk to us about how they're using our budgets, the policies that they're trying to pass, public health, what they're seeing and how they're hearing us. But it is not to elevate or promote anybody's platform or career. This is all about education. So with that said, I am so excited for our first panel, the health panel. I am going to invite our panelists on. Please make sure that you share this event, our social media graphics with your friends, because we're going to do this every week and they're going to be more specific. So you're going to have an education day, you're going to have a health day, and you're going to have wealth. So give me just one moment. As our, how are y'all doing today? And I'm actually gonna mute myself and so that you all can take it from here. Thank you. Oh, let me see. I think our last panelist she's joining us. And then if you have this open in multiple windows, let's like close it maybe so there's no echo. Thank you.
Okay, great. So thank you all for coming today. I'm really excited just to have a discussion with the panelists. I'll begin by just orienting everyone and then eventually introducing everyone to this event. So this is the Black America Summit. I'm Dr. Adolfo Cuevas, director of the Psychosocial Determinants of Health group at Tufts University. And this event will span for the entire month of June. So as Riel Jones mentioned, every Friday, scholars, clinicians, and elected officials will convene and connect with Black Americans across the country to brief us on the current social and political and public health landscape during the COVID-19 pandemic. And this is also coming at the heels of sobering events of the ongoing police brutality. So in doing so, we as people can have actually a more comprehensive understanding of the causes and consequences of not just COVID-19 disparities, but existing social and health disparities that overwhelmingly affect Black Americans. We are fortunate to kick off this month's event with two great panelists who have been on the front lines of COVID-19 pandemic. The panelists are based, if I'm not mistaken, in New York, and so they actually have firsthand experience on the issues of New York residents. But actually, to help set the stage, I think it's important to actually give a quick account on what has occurred in New York. So the first confirmed COVID-19 death in New York City actually occurred on the second week of March, March 11th to be exact. At one point, but actually at one point, the death toll even reached a horrible peak of 590 deaths, and that was on April 7th. But many actually argued that actually is an underestimation. But in any case, what was illuminating is that a disproportionate number of those cases were black and brown people. Similar patterns actually have occurred and is occurring in other cities. So the question is, what's happened? Why did this occur? How could this actually have been prevented? Are there many different angles we could take in order to understand the causes of these disparities, such as structural racism, lack of access to healthcare, or just a feudal leadership that's going on right now? So our panelists are here to give actually a firsthand look at how it is working in the front lines against COVID-19. So we're here actually to help demystify some of the pandemic and give us a better understanding of what are the next steps, what should be the next steps to reduce suffering and eliminate existing disparities. So today's questions don't come from me, who I'm basically a pseudo moderator, but actually the questions come directly from the community. But then we're also going to be taking some live questions through the feed. So without further ado, I just want to go. I guess you go free to introduce yourselves. Dr. Chidubem Agweze, please feel free to introduce yourself and just briefly mention some of the work that you have been doing.
Hello, everyone. My name is Chidubem Agweze. I am a third-year resident at Mount Sinai Hospital in the radiology department. During the COVID-19 pandemic, normally I'm reading x-rays, CT scans, MRIs, not really seeing patients, but during the pandemic, I was redeployed to the internal medicine floors because there were every patient in our hospital system at that point was a COVID patient, and the whole hospital system was stretched. So there was a 2-month period where I left my radiology duties and was doing clinical work on the floors, taking care of mainly COVID patients.
Yeah. Thank you. And also we have Dr. Andrea,
No,
please.
not doctor yet.
Well, a future doctor.
I'm in graduate school right now at Georgetown University, but definitely not a doctor yet.
I'm hopeful you will be. So
I'm planning on it, though. I'm planning on it.
So please feel free to give us a little bit of background of your work and how it relates to the current pandemic.
Yeah, so I'm a graduate student right now at Georgetown University. I'm studying epidemiology and health equity, and I'm the founder of Health Equity COVID-19. So it's just a small volunteer organization where we're just educating people about COVID-19 in the Black and Brown communities. And also I work at a hospital too. So a lot of my coworkers are frontline workers. I'm not a frontline worker, but I have a lot of coworkers that I work with, and I can speak to that. And yeah, I've worked in healthcare for a while, about 10 years in public health. So I have more of a public health perspective.
Yeah, so let's start off, because I think there's a common thread across all three of us in terms of what have we been hearing about the COVID-19 disparities, and what do you think are some of the causes that are or potential drivers that have influenced differences in the suffering of COVID-19?
Yes, I'll take that. So across the Mount Sinai hospital system has about at least 3 hospitals in Manhattan, and I was in the hospital located in Harlem, which serves a predominantly Hispanic and African American population. And just within our hospital systems, we noticed that the patients that were coming to the Morningside Hospital had worse outcomes, had more higher level of ICU stays, and this was mainly because that patient population had a higher rate of comorbid conditions like diabetes, hypertension, renal failure, obesity, COPD, all these health conditions that predispose someone to have worse clinical outcomes in general. And then specifically in COVID-19, we just saw that these patients just didn't do as well. And the causes of that, we can extrapolate to people in African American and Hispanic populations not having access to adequate primary care that would then manage them to prevent them from getting hypertensive in their later ages, preventing diabetes, smoking cessation programs that would prevent them from smoking and then stop them from eventually getting COPD and emphysema. So all these things compounded to the point where people just there's just a higher rate of comorbid conditions in people of color, unfortunately, which then led to them suffering disproportionately to this respiratory disease.
That's great. And I guess, Andrea, you have a bird's eye view, I guess, given your background in epidemiology. So what's the framework that you and people in your field operate from?
That is great. Great question. So we're just looking at how fast the disease is spreading. So for Black and Brown communities overall, actually, let me take a step back. That's a good question. I feel like let me see. Great question. Okay, well, anyways, let me go back to what I was going to say, because I had something I was going to say before. I was going to say something about health literacy, and now okay. So I guess I was going to add to what the other panelists said about another reason for the cause of the disproportionate impact of COVID-19 is, I think, also low health literacy. I was going to make that point, and because I think with the information dissemination about COVID-19, I think at first it started off like academic institutions, like I think they kind of were more well-informed than the general population of what COVID-19 was. And especially I take like infectious disease epidemiology, that we are following basically COVID-19 since it was in China, then it went to Italy and to other parts of Europe. So we're kind of well informed of what was happening way before the general community. And then just thinking the way the information is disseminated throughout, healthcare information is disseminated throughout the United States, that it, kind of like starts at the top and trickles down. I feel like the information didn't get to the Black and brown communities until it was probably too late, and they didn't know how to adequately protect themselves from COVID-19. And then just the general misinformation with wearing masks and things of that nature. Yeah, that's another reason for the impact of COVID-19.
That's great. And so I guess, going back to the idea that much of these disparities has already, even prior to COVID-19, disproportionately affected Black and brown people. And this just seems like it has basically exacerbated these existing disparities. What are some of the discussions that are happening now that you feel could actually be a moment for change?
I guess I would say just more health education, people, just in general with your healthcare, being more of an advocate for yourself and your family members. I know I've taken on that role to just educate my family members that came to me with questions about COVID-19 that were kind of far-fetched, but just educating them and be patient with them and giving them the correct information and just doing what you can to share the correct information with the community and just teaching people how to advocate for themselves. Because I think a lot of people in general don't know how to advocate for their health in the healthcare system because it's so complex. So,
excellent.
I feel like there was a point where Dr. Fauci actually vocalized on national television that this was a thing that was disproportionately affecting African American people and people of color in general. And I felt that was like an important moment because usually when these things happen, no one in that position actually acknowledges it. We just know that it's happening, and then there's usually not even a conversation about it. So that's like a step in the right direction, at least.
So this is really good. So let's follow that up with because you mentioned Dr. Fauci, and I think his name now has been tied to conspiracy theories and controversy. And so I wonder, what are some of the myths that you have heard from your friends and families about COVID-19 that you wish could have been or should be dispelled soon?
The two that I'm kind of peripherally aware of is that one that like Black people are super spreaders, which is just not the case. It's just not
true at all.
At all. It just doesn't. It's not. It's not based on reality. Period.
No. If anyone says that, don't listen to them.
If anyone says that, they don't know what they're talking about. And the second one is there's a lot of apprehension around food that I've noticed. A lot of people asking me, can I like order food from this place, or can I eat? Is it okay to order delivery? Can I go to the grocery store? Should I wash the food more than normal? There is like data out there saying that like the SARS the virus has a high fomite rate, which means that it can like live on surfaces for a long time. But if you're eating anything, especially like meat, you've cooked it for a long time. You've cooked it well, and that definitely deactivates the virus, and you can't get it from eating food. If you're ordering from somewhere where you're not sure that they're like cooking it well enough, you shouldn't order from them, period. Like it's not like a COVID-19 specific thing. Like if you're not confident that the place you're ordering food from is like sanitary enough and cooks the food adequately, that's not something that's like specific to COVID-19. That's like something you shouldn't do in general. And you would get other illnesses besides COVID-19 from them.
The term super spreader. So one of our questioners asked, "What is a super spreader?" Even before we continue.
In terms of COVID-19, I don't even know that's a.
It's a thing because I've read about it in my coursework. Like there's some cases from different epidemics where you've had super spreaders, like maybe there's like one person like in the previous SARS outbreak in China that spread it to like 40 people, where it usually only spreads to 2 people. For whatever reason, that one person was able to spread it to multiple people. So it's not any basis on race or anything. It's just some people, they're able to spread the virus more quickly than others. So but usually it's like one, like usually a person only affects 1 or 2 other people, not like 40. So if you're doing that, I'm not sure why that happens, but it's been noticed in other previous epidemics besides this one.
I am aware of that, but the for instance, I'm not sure about the SARS specific case, but like in other like viral cases like HIV specifically, like the people who are termed super spreaders weren't because like they were different from anyone else. It's just like their behavior allowed them to spread it to more people than anyone else. So like if someone is like, for instance, if someone had COVID-19 and then got on a plane and flew to every country in the world, then they technically would be a super spreader, but that doesn't, it wasn't their biology that caused that. It's because they partook in an action like that then caused them to spread it widely.
So then this goes to the next question about, does it make sense that COVID is being racialized in the public media?
I think I'm not sure when saying racialized in the public media, what that's referring to. That's mainly because my consumption of media is kind of I don't like watch cable news. I strictly listen to like 3 podcasts for news. So I'm not sure what that is in reference to actually.
Yeah, and I guess this particular question is in reference to the idea that a lot of the attention that has been placed, in particular, focusing on the Black community, doesn't really contextualize it within the framework of segregation, structural racism. But at the same time, it's a double-edged sword that if you don't shed light into these issues, then it could get overshadowed by other news. And so I wonder if either one of you have thought about ways that the media could actually approach the situation in a much more comprehensive way.
Now I understand the question. So I think the question is trying to ask or bring to mind the idea that when people stress that this disease is mainly affecting people of color or Black people specifically, then people are less likely to pay attention to the disease itself or think it's something that's just only affecting Black people. And that doesn't give them the context that this is affecting Black people because of the background of low socioeconomic access to health and all of that. And I'm not sure how that can be remedied in all news outlets.
CNN has reported some, or I've seen like some reports on CNN where they brought in like Black epidemiologists like Dr. Comrade Jones and some other Black epidemiologists that spoke to that, but I guess maybe doing that more frequently because there are experts that can speak to this and they have been speaking on it. It's just having them more in the forefront.
Another solution to this is choosing your source of news. So you don't have to watch CNN or Fox or MSNBC. I don't, and I think I'm fairly informed.
Is there a particular source of news that you find valid and reliable during this moment in time?
Yes. So the New York Times, The Daily podcast, it's a daily news podcast every morning, has been fantastic. This from January when it was still in China Like they have been amazing in their coverage of this. No, up NPR's up first as well has also been good, but it's more, it gives you like a more general what just happened the day before. Let me see. I should have a list. Let me look at my list of podcasts.
And there's one I listen to. It's like the Epidemic podcast. It doesn't speak specifically to Black issues, but at least to get a sense of the history of coronavirus and just like the epidemiology of coronavirus and just the immunology and the current drugs that are in development. There's some like specific people I particularly follow just to see if they ever like publish any information on COVID-19 and health disparities. I think her name's like Dr. Uchi Blackstock, and there's some other doctors that I follow just to see what they're saying on COVID-19.
Great. So we're almost close to opening up the discussion for the audience. But one question that I think is in the minds of many, especially since we were just talking about how super spreader can actually become stigmatizing and discriminatory, is the idea of contact tracing. So if any of you could potentially define what contact tracing is, and maybe potentially some of the advantages and disadvantages of contact tracing.
So
I guess.
Go ahead.
Oh, I was gonna say contact tracing. Basically, if let's say if you found out you had COVID-19, somebody from the local Department of Health is gonna call you and basically ask you everyone you've been in contact with since you think you got your infection. And then they're going to go reach out and call all those same people and basically track everyone they've been in contact with so they can basically isolate them so they don't potentially spread COVID-19 to more people. So we can reduce the amount of people that are infected in the population and not expose it to more people. So I guess the downsides would be maybe some people are concerned about their privacy. And then also maybe you need to go to work, but you have COVID-19 and maybe your workplace is not flexible with you being sick, so that could be the downside, but I'll let the other panelists.
Yeah, that's a great definition of contact tracing. Like that, the contact tracing is what actually worked in like South Korea and Singapore. Like that's how they've kept their caseloads down. They started testing early, and anyone who was positive, they tracked down all the people they had contact with, isolated them. And that's how they're able to have a lower death rate than we do. And on top of like the contact tracing, I think that South Korea, if you're being quarantined, you get paid by the government, I believe, in China and in South Korea to offset the financial effects that you're experiencing for staying at home for 2 weeks. That's definitely something we can do here. We have the money to do it, but not the political will.
Yeah, I guess, I mentioned I'm a pseudo moderator, so I might be chiming in with a different perspective. And I think the perspective that I have is coming from the public health perspective. And the idea there is that I think one of the dangers about contact tracing is that it decontextualizes people's lived experiences. It basically ignores some of the historical context that shapes people's lived conditions, especially in terms of aspects of like how government supported redlining, and it has basically disproportionately affected Black community members from getting actually adequate jobs, access to healthcare, and stable housing. And I feel that contact tracing, although the technology is, they mentioned is actually quite effective, it doesn't necessarily capture the lived experiences of these individuals, and in turn, it could actually lead to stigmatization and discrimination, something that we're trying to prevent in this moment in time. So I don't know if any of you have any thoughts there.
I actually haven't thought about it that way. In my mind, like, the less people that have this disease, the better. Like, just period. So like that, I feel that just having, that's in the context of my experience in the hospital during the peak. Like people were not doing well. Like They're not. It was people were dying. There was a day I had like 4 patients die. Like it was not. It's just best to not have this
Yeah.
be a problem that you're facing. So I understand that it can cause like stigma, but like if you're still alive and experiencing that stigma, as opposed to like, and I know this is like a narrow view. Like as I acknowledge, as a physician, we're usually um, not well in tuned to the social effects of health. That's a fact. We're like we know we have a hammer, and to everyone not to everywhere where everyone is a nail to us. So I understand that, but I guess I'll just say I haven't thought about that aspect of it.
Well, I guess you mentioned maybe potentially a catch-22, but I want to get Andrea's perspective on this. If Andrea, if you have any thoughts there.
Yeah, I'm like, that's a good question because that's not something I thought about either before. But I'm just thinking because I like get the weekly report from the hospital I work at about the amount of people in ICU, on ventilators. And then at one point, I don't know if it's still open, like DC, they opened up a field hospital at the convention center because there's basically too many cases at our hospital. And I'm like, I don't know. I just think, yeah, it's better off like isolating and just making sure more people don't get infected than ending up sick or dead, because I know people that have died and gone sick from COVID. And sometimes people have like a long recovery too. Just because a lot of people recover doesn't mean they're like in great health right after they recover. So I think
we also don't know what the long-term effects of this are, so it's just best to avoid it.
Yeah, I guess the one of the issues with another issue that comes to mind with contact tracing in particular is that it also kind of removes people's actual work experience. A lot of Black community members are work in jobs that are essential, and so if they actually do get infected with the virus, the suggestion that they have to stay at home is sometimes not viable. And at the same time, a lot of these contact tracing could potentially be false positives. And I also wonder whether that could actually be an additional stressor, not only for the individual, but also for the community as well. Just something that comes to mind as well.
Most definitely. I remember at the very beginning we had like a town hall meeting for my hospital system, and this was back when the CDC has sent out their own version of the test that was not working, and it was just it was definitely very, very stressful because at that point we already had patients coming with symptoms we suspected to be COVID, but we didn't have any way to confirm those cases. So yes, it can definitely be a stressor. And this is not just something specific to COVID-19. Just any test that you have that can give false positive or false negatives just cause unnecessary anxiety or relief.
Yeah, and so I also want to ask this question. This is a great question from one of our audience members, and I think it actually is a very comprehensive one in terms of the discussion we're having now. Are there ways to help address many Black Americans' reluctance to engage with the medical establishment due to the historical discriminatory treatment? It's a great question. I'm wondering if any of you have any insight there.
I would just seek out a Black, that's my personal thing, seeking out Black healthcare providers to do your medical care. That's what makes me feel the safest, or just like interviewing your medical providers before you actually go sign up to like have them do your whatever exam, interview them and ask them questions to see if you think they might be discriminatory.
Yeah, so I've thought about this, and my solution, or like a solution that I have for like my friends and family members, is I have I have equipment for them to take vitals, so they can take the blood pressure, heart rate. I've given them a pulse oximeter, so they can take their pulse ox. That way, they can give me the information to me, and I can be like, yes, you need to see a doctor.
So I think it was just getting really good, and so I think you just froze for a minute. But
I do the same thing. I have a pulse oximeter that I like recommended my family and friends to buy one, and if it gets to like around I think 90 or below, you need to run to the doctor and take your temperature. I've sent like masks and gloves to different family members, just like things that they can do as much as they can at home before they need to seek out medical attention.
Yeah, and I guess for that question, what I would add, this is an opportunity for policies to be put in place to actually change the medical system. I mean, they've done, quite frankly, a poor job in reducing medical mistrust. There's still high rates of mistrust in the community due to ongoing historical and then ongoing discrimination. And if anything, this is an opportunity for the healthcare system to increase diversity, have more Black physicians, nurse practitioners, nurses within the healthcare system. But then at the same time, this is an opportunity to change the structure, to increase access to healthcare. So let me see if there are any other questions, because we're just about done with the time here. Let's see in regards to the pool. So I think this is a broad question, and I'm sure, Andrea, you've thought about this. Where do we go from here?
That is a great question. I think it's really important who you vote for. So making sure you go out and vote in your midterm elections, primary elections, presidential elections, state, local, just because we need better healthcare coverage basically for everyone in this country, especially the frontline workers, which are mostly African American. So if we don't have good medical care coverage, then almost, it doesn't, nothing matters basically. Let's see, what else? Is he back? Where else do we go from here? And maybe more paid sick leave for basically everyone. So if you get sick, you can take time off and take care of yourself and your family.
So, so the question is, where do we go from here? We're the COVID-19 pandemic has not ended, even though it kind of feels like it. But no. we're still in the midst of it. So, a question for you, where do we go from here?
So there are a couple of things. First, is the idea that a vaccine will be ready soon. I personally am not optimistic about that, and this is why. The fastest vaccine ever developed in the history of like vaccination took 4 years. It was a mumps vaccine. The virus was isolated in 1945. The vaccine came out in 1948. And that initial vaccine only conveyed like a short-term immunity. And the actual vaccine for mumps came out in 1967. So that's that's 12 years from isolation of a virus to actual long-term immunity vaccine. Maybe we've made tremendous strides in technology in that time. But the work that I've seen for other SARS vaccines don't like inspire me, like instill me much confidence. That's one. And I want to be wrong about that. I really I want to be very wrong about that. But I just feel like that we should prepare ourselves mentally for that. Secondly, this is gonna come back very like vigorously in the winter, And I think everyone should have stock up on masks they're gonna need to wear when they're going outside. Have some form of way to have a direct contact with a physician that can like evaluate the symptoms remotely through telehealth or in person if you can get to urgent care.
Well, can you actually just illuminate for us why is projected that there's going to be an increase in the fall?
So this is based on what happened in the 1918 influenza pandemic, where the virus at the very first wave of the virus was more virulent, but then went down. It kind of tapered off. The second wave wasn't as virulent in the sense that the disease itself then wasn't as fast, wasn't as fast as killing people, but it was faster at spreading. We're not sure if that's going to be the case now, whether or not it's not going to kill people as much, but it's postulated that it's most likely going to come back. Like, I don't see it not coming back.
It's scary, and I guess like then going to the question about where do we go from here. I think one of the ways to perhaps answer that question, at least from a public health perspective, is that we perhaps have to name what's going on head on. That this is just racism operating in a particularly new way. That the reason why Black Americans had higher rates of diabetes, obesity, hypertension, short length of life is because of structural racism that has been pervasive in the United States. And with not naming it head on, I think we will commit the same error in not necessarily finding the most comprehensive and effective ways to reduce the spread of COVID-19, particularly in the Black community. So I completely agree with you too that there are and I appreciate the practical suggestions, and I think those suggestions actually could help the Black community in preparing for what's to come. And I think from a bird's eye view, implementing policies to actually prevent this from happening again in the near future is also critical. So I want to see if there's one more question. There are many here. I guess the last question I would ask is, how are you two, and how have you coped with this pandemic so far?
Honestly, I'm in graduate school and I'm working full time, so I just been like working like mad to not and just trying to help my family as much as I can, and trying not to think about it too much.
I've had some like really rough days, like really bad days, but I would like to reach out to my family doesn't live close by. They live in California, so like I FaceTime them, talk to my mom, my sisters, FaceTime a lot of friends. There was a period of time where like for like 6 weeks, it was just me in my room because I was like quarantining because I couldn't see anybody else because I was seeing COVID patients every day. So it was rough for a while, but
now are there
stuff that gives you purpose, so like it makes it okay.
Well, and I want to get to that in terms of like, are there things you have done to maybe cope with it that you maybe have shared with friends and family during these times that perhaps our audience could appreciate?
I've been like drawing a lot, so I used to draw a while ago, and then like med school, grad school, residency happened, and like it just fell off. And now I've like gone back to it, and it's nice. It's like a positive. I picked that up again.
That's great. And for you, Andrea?
Outside of school and work, have I done anything? I guess maybe just going for walks more in my neighborhood because I live in Maryland and I was like used to like running back and forth to campus all the time, but just having time to like get to know my neighborhood a little bit more and walking around, and I guess that's been nice.
That's great. Well, I want to thank you two very much. I think Riel is here. There it is. Perfect timing.
Yes, this was amazing. Oh my goodness. Thank you for like setting the foundation. Like, I really just want to have an open conversation around like, what are we seeing? What are things we're hearing like from people who are actually trying to like help us fight this and like get the education out there and all of that. So thank you so much for being a part of this. We're definitely going to have this on YouTube and our Facebook so that people can share. I've had a lot of other people, even while we've been on here, like, I missed part of it, but I want to see it. Please share it with me. So I know that this great information is definitely going to get out across our communities.
That's great.
Thanks for having
us. Great. Thank you.
I guess I want to just quickly follow up that there's another event coming next week, next Friday.
Yep. So next Friday, we'll have more panels. We're going to continue to grow off of this conversation. So definitely check out our different platforms, our different social media pages, the Black America Summit, and we're going to keep updating you with the topics that are coming up and the panelists that we have.
Great. Thank you so much.
Thank you so much.
Thank you.
Thank you.
Bye.
Have a good